Talk about longevity, 50th graduation year, huh?
That's extraordinary, Robert. Yeah, that's extraordinary, Robert. Yeah.
Yeah, congratulations.
Yes, indeed. Someone else coming in here the way it looks. All right. Well, Joe, if you'd like to begin, we want to honor these folks' time that's here. If folks come in later, we will welcome them. And I just want to welcome everyone from all over the world, from the Netherlands, right, Aline? Right? The Netherlands to Corrales, New Mexico, to all of us in the Western New York area. Uh, Joe, thank you very much for being here with us today. I will let you go ahead and handle your introduction. And so I just want to say, uh, Joe is a friend, a dear friend, and has done some great work for me as far as my health is concerned, along with Beta, who you're going to meet as well. And so thank you so much for taking your time out this morning to do this. Excuse me, these allergies are getting to me these days. Um, and so, Joe, let's without further ado, let's go over to you. So, ladies and gentlemen, my friend and colleague Joe Fox.
Thank you, Roger, for inviting me. And thank you for everybody who's on this call for showing up and having an open mind. I want to thank you for the work that you do, and most importantly, for recognizing the need that and I'd like to include myself in that as I would like to consider myself a medical professional along with you. We need to do a better job as an industry, not to be trite, but to truly change the way medicine is done. So please never give up, never compromise, never stop fighting. One student at a time, one patient at a time. I really mean that, and thank you. I've had the opportunity to meet some of you over the years. I'd like to, as Roger alluded to earlier, introduce a friend of mine that I invited to be on this call, which is Beta Fernando. And I met Beta through the UB Center for Entrepreneurial Leadership, where I had the opportunity to mentor her a little bit. And Beta is a registered dietitian and a certified diabetes educator with a master's degree focused in weight management. She is also certified in gut health by Monash University in Australia. She is the founder of Fuel Nutrition PLLC, a highly customized nutrition consulting company focused on transforming health through nutrition. She is passionate about a food-first approach, along with behavior modification, accountability, and evidence-based medicine to strategically guide her clients on their journey to health. So I'm going to briefly introduce myself. My introduction is part of the presentation. And so this is my company here. And oh, wow, this is actually working. This is a little video of 30-second video of the work that we do. I do believe that if a picture is worth 1,000 words, a video may be worth 1,000,000. And so I chose these clips because I think they kind of resonate with the kind of client that we work with, the kind of work we do, and the kind of coaching that we do. So our story is that we are a concierge medical fitness company, and we really integrate strength training. Some people think of that as personal training, physical therapy, or you could use the word corrective exercise, and nutrition. And this young gentleman in the lower left-hand corner of your screen is a gentleman named Adam. And I saw him post on Facebook, and he had come to us. He was told that he needed a low back surgery. And thank God we were able to work with him. He didn't have surgery, and he competed in his first Tough Mudder. So it's kind of pretty cool to show kind of what could happen. So my company integrates strength training, physical therapy, nutrition to help our clients move without limitations, stay strong for life, and continue to participate in the activities and the sports that they love. And recently, I would add to that a little bit and say, not only the activities and the sports that they love, but also the things that they need to do. For example, right now we're working with a 72-year-old man who's kind of kyphotic and bent over, and he walks with a cane, and his wife has cancer, and he's going to be her primary caretaker. And her doctors are very worried that he's not going to be able to do that. So this is real life, real stakes. It's not just about, I guess, having a six pack, if you want to look at it that way. So it could be anything: golfing, tennis, pickleball, gardening, playing with your grandkids, anything else that matters, without pain. Now, I'm going to skip this little video here, but I want to kind of discuss it. I created a video a few years back, and really the video is just kind of a call. And I think this call can resonate with each one of you, your parents and your family. And in this video, I said, are you in your 40s or 50s and 60s or older? Are you in pain? Have you tried to get help? Have you met with your primary care physician? Have you worked with a physical therapist, or maybe a massage therapist, or an acupuncturist, or a chiropractor, or maybe even an orthopedic surgeon? Did you get the help that you needed? Are you in pain? And then the real tragedy for me is when, and you've seen this in the grocery store, you've seen it in the mall, you've seen it in your family, perhaps you've seen it at church, is that people will get in pain and they get help, and they don't find the results that they're looking for. And the real sad thing is when they start to say, well, I'm just old now, so I guess that's the way it is. And my company, and I know my colleague and my good friend, Dr. Tracy, adamantly believes in the vast majority of cases that's just not the case, that you do have a choice, that if you're treated with care and intelligence and strategy, that you can get your strength back. You can feel great. You can be strong. You can thrive. You can feel better than you did 20 years ago. And we know that's true because we've seen it over and over and over again. So we want to really get that message out there because it's something real, especially right now as our population is aging. And that's what our company's all about. And there's no better compliment or nothing that gets me more excited when one of our clients unsolicitedly will come to us and say, wow, I feel better than I did 20 years ago. I'm stronger than I was 20 years ago. I'm more functional than I was 20 years ago. And when we talk about longevity, the two most important factors are strength training or resistance training and nutrition. And we'll touch on those a little bit. So my story starts with medicine. I was a young, goofy kid, teenager, powerlifting champion, lifted a lot of weights, trained some national champions, and I got hurt at the age of 19. So my experience was trying to get help, going everywhere I could. My primary care physician was first, physical therapist was second, personal trainers, chiropractors, orthopedic surgeons. And unfortunately, I didn't get the help that I needed. And then one day I was at a physical therapist's office, and I really think it was, quite honestly, divine intervention. On the way out, I happened to notice that there was an article that was photocopied, and it was stapled together on a chair, on an empty chair that somebody had left behind. And it was this article right here. You're sitting on a time bomb. And it was an interview of Dr. Stuart McGill, who at the time was a PhD professor in the chair of the board of the Department of Biomechanics in Waterloo over in Ontario. And I read this article, this 5-page article that the first page was a picture. It was written in Men's Health. It was written in layman's terms, probably for the level of like an 8th grader. And from reading this article, I was able to do what the 7 doctors I had met with before were unable to do. I was able to fix my low back. And I distinctly remember when I started in my career, I was at a health fair and there were 2 doctors at a table or a booth next to me. And it was just a wild experience. They came up to me and they said, "Wow, how do you know so much about low back pain and so much about fixing your low back and the spine?" And I thought to myself, quite literally, because I read a 5-page article, mostly pictures in Men's Health, written in layman's terms. And I think that really is an important point, because there's so much ego in medicine and in so many professions, and a lot of this is really quite simple. So I think it was kind of important just to put that out there. And I'm just going to go up to a certain slide and then switch screens. All right, so a little bit more about me. I'm a certified strength coach. I have a bunch of credentials. We kind of made our way into healthcare by being recognized by Business First as winner of their Healthcare 50 Award, which recognized medical professionals for their contributions for improving the quality of healthcare. I've done a lot of speaking, a lot of big organizations, so that's been a lot of fun, and I've enjoyed that. But all of that aside, we've been really blessed, in large part due to Dr. Tracy's mentorship and friendship, to regularly learn from, teach with, and collaborate with many of the best minds in the fields of physical therapy, sports medicine, strength and conditioning, and performance training. And with Dr. Tracy and some of our other colleagues, we would like to believe that we have kind of built a clinic without walls that provides unprecedented access to the leading medical practitioners in the world, and has helped our company become the go-to solution for people that are in pain. The medical system didn't give them the relief or the solution that they were looking for. They really want to get out of pain. They haven't given up yet, and they want to avoid surgery. So yep, that's right where I wanted to get to. That is my brief introduction. Now, I want to change screens, so let's make sure this copies over with the screen share. Okay, can everybody see that? Steve Jobs, Peter, can you see that? Can you lift up your hand? Okay, great, because sometimes when you switch around, it doesn't work. So this whole presentation is really about keeping it simple, making it easy to succeed, which I think is just so important. And by the way, if you see me looking all over the place, it's not just because I'm crazy. It's because I have 3 monitors with different things on it. So you understand that. And so, keeping it simple is extremely important. I remember I had a meeting with a highly ranking executive, top 3 executive in Kaleida Health. I don't know, maybe about 8 years ago, approximately, or so. And this person had terrible low back pain, and they were looking to lose fat and get leaner and be stronger and feel better. And I sat down with them and we did a presentation on nutrition. And I remember the executive looked at me and they said, boy, this isn't going to work. There's not enough science in it. This isn't sophisticated enough. And I attempted to the best of my ability, and I think I pulled it off. I looked that person in the eye and I said, you drink 8 glasses of soda a day. This isn't a science problem. This isn't a knowledge problem. You know that soda is not good for you. Your 10-year-old knows that soda is not good for you. But we could do the science. I could show you 1,000 studies of the DNA of sugar and what it does to the body. But that knowledge is not what's preventing you from not drinking that soda, from changing your lifestyle. And so many things are about keeping it simple and really about behavior modification and developing good habits. And I thought that was kind of a powerful lesson. So in August of 2022, I was in Providence, Rhode Island at an event that I've gone to 10 different times, and these guys were there. This is Dr. Gray Cook on your right and Lee Burton on the left. And they own this company called FMS. And, their motto is move well, move often. And they came out. Dr. Gray Cook was giving, well, actually, he's not a doctor. He's a physical therapist. So I guess he's a doctor of physical therapy. But he was doing a presentation. This is actually some slides from that presentation. And he brought about a really simple concept. And I want to spend a little bit of time on that today because I think it's really important. And now I need to switch my screen. So let's see if this switches over. I might need to change the share. So can you guys see something? It says the 3 7s, or do I need to redo the share? Yes? Cool. Awesome. So I thought this was profound. And in my life, it's the simple things, it's the profound things that make all the difference. He said, do you want to know what fitness is? Do you want to know what health is? Do you want to know what the foundation of longevity is? And he said, it's the 3 7s. Are you walking 7,000 steps a day? Are you drinking 7 glasses of water a day? Are you getting 7 hours of sleep per day? I mean, this is pretty simple, but I find that there's a hierarchy when it comes to the human body and function and strength and health. And I think it's critically important to start right here. We need to move. We need to walk. Besides breathing, we walk more than doing anything else that we do in our life. And yes, it's simple, but you've got to start here. Are you moving? Are you drinking water? Are you sleeping enough? And in your profession, I can imagine sometimes as you balance your job and patients and students and family and dogs and kids, that might be challenging. But I want to go really back to the fundamentals right here and ask you to focus on these simple things. Okay. And I'm going to switch my screen again. Okay. So I've been very fortunate that I met this man, Dr. Brandon Marcello. And Brandon Marcello founded a company. He was one of the founders, a co-founder of a company called Athletes Performance that changed their name to Exos. And one of the smartest guys I've ever met. And his job is he works for the U.S. military. It's to create the ultimate military human athlete. And they use consumer off-the-shelf wearable products to do that. And what he does is he tests these products in 3 different independent labs to see how accurate they are. 2 products that he uses, I'm showing you my Aura Ring. I don't know if I can't see myself, so hopefully you guys can see me, but this is my Aura Ring, and here's a picture of an Aura Ring. And it's great in that it measures your sleep, not how long you've been in bed, but how many hours you actually slept. It measures your lowest heart rate and your highest heart rate and your average. It measures your heart rate variability, and it measures your temperature. So among other things, this has been an amazing tool for me to know, do I have COVID? Am I sick? Because it kind of seems to me that your body temperature doesn't lie. Another thing that he uses is an Apple Watch. And those he found among two of the cheapest and most accurate ways to kind of keep track of some of that stuff. When you use this stuff, I'm going to bounce back to the Oura Ring, you learn some amazing things that really matter. Number one, when you don't get enough sleep, boy, it really affects you. It affects you a lot. When you eat late, it really changes your heart rate variability, how much you sleep, your quality of your sleep, et cetera. And another one, just keeping it very simple, is that when you drink alcohol late, it is unbelievable. So years ago, Mike Geraci and I were in a presentation from Dr. Chris Powers from USC, and he made the point, and I thought it was an awesome point. He said, it's one thing to tell somebody something, it's one thing to show somebody something, but if you could show them a video of themselves, if they could see their own performance. And I'll tell you what's amazing, and what Dr. Marcello said that he really gets out of his athletes, is they can see when they stay out late and they eat late and they drink alcohol late, their heart rate variability literally is down 50%. 50%. It might go from 80 to 40 or 60 to 30. I mean, it's amazing. And their heart rate, if they had 3 glasses of wine or 5 beers, literally could be up 15 beats per minute on average during their 6 to 8 hours of sleep. I mean, it's staggering. And I remember working with people on nutrition over the years, that there was this national weight loss registry, and it was a group of people who had lost 50 pounds or more and kept it off for a period of 5 years, which is pretty impressive. And they cited the number one thing that they did is they had a food log. They wrote down everything that they ate. And I think, wow, that's pretty wild. And so I feel with the Oura Ring and the Apple Watch that it allows you to easily kind of get a little bit of a snapshot of what you're doing. Okay. And I want to talk about walking for a minute, and I'm going to jump over to another screen. Can everybody see? It's where it says 23 and a half hours. Is that right? Good. Okay. So this is probably, that's a 9-minute and 18-second video. We're not going to watch it. If you find it interesting, please write it down. And this particular doctor, Mike Evans, had done just all kinds of research. And he determined that the single best thing that you could possibly do for your health was to walk 30 minutes a day. More than, anything else you could do. And I think he did a lot of studying on people in Japan who had to walk to work and walk back home. And just amazing. And we're going to run with that theme on walking for just a minute. And I'm going to click over here. I had something on my screen. There we go. It should say Chapter 10, The Walking Program. So this is a book written by Dr. Stuart McGill, who I mentioned earlier. And he wrote a chapter in his book. It's like a 3-page chapter. It's called The Walking Program, Nature's Back Bomb. And it's amazing. When we walk, I'm going to stand up for a minute. You can see my home gym. So much is happening. One of the things that's important to note is that inactivity is the 4th leading cause of death in the United States, or excuse me, in the world rather. And it's highly correlated to, I think, 4 out of the top 6. So even getting up and walking can make a huge difference. And not just walking, but when you walk, you want to stand tall, look straight ahead. You want to walk fast, and you want to swing about your shoulders. So yes, we can get really in depth, and we could talk about anatomy and core stabilization training, and we could talk about universal laws of human movement, like core stability enables distal mobility and athleticism, and I could do that. and I really enjoy those conversations. However, if we do those things, if we drink enough water, if we walk regularly, if we sleep regularly, we've got to have that first. So pretty important stuff. Now, I'm going to switch over to another screen. All right. Yeah, I think this is it. So now when we talk about exercise, walking is important, but I want to also talk about strength training. So I'm kind of a really big believer in that I like strength training because if you can do it, if you're going to kind of bump it up from those three things that we discussed, strength training gives us literally all of the benefits of cardiovascular training, but it gives us some extra benefits that cardiovascular training doesn't give us. So strength training builds bone. It changes the shape of bone. It builds muscle. It helps you to be stronger. Yes, it improves your cardiovascular health. It improves flexibility and mobility. It improves balance. It makes you fall resistant, less likely to fall, and more resilient if you do fall. And it improves your cognitive function as well. Flexibility and mobility is important, but and you should do it. And Dr. Tracy has taught me over the years that as we age, we start to lose flexibility and mobility every day. But passive care doesn't really create change once we get past those 3 sevens. We're not fragile people. I remember I had the opportunity to work with a brilliant doctor who graduated from Johns Hopkins, graduated with a 4.0 average, serial entrepreneur, created several companies that did extraordinarily well, really smart guy. He had low back surgery. I think he had 2 low back surgeries over at the Cleveland Clinic or the Mayo Clinic, one or the other. And I remember looking at him, and he had really let his body go. And I could really feel for the man because I looked at him and I said, here's a really smart guy who's worked really, really hard. He's provided for his family a great life. He's put his 2 daughters through college. And I don't know if you guys know this or not, but the number one reason why somebody loses their independence and has to move into a nursing home or a living facility, an assisted living facility, is because they can't get off the toilet. I mean, it's pretty powerful. And I remember saying to him, look, I don't want you to be in pain, but if I have to choose between you being in pain, and most of the time we don't have to choose that between you being strong and functional and being able to live your life and living with some pain, I'm going to choose the latter, because he worked too hard to, after everything that he did and how he provided for his family, to have to move into an assisted living facility and lose his independence. So strength training is really important. When you do strength training, your comfort zone really is a cage. You need to work near or at your level of capacity to create change. We have this quote that we got from Dr. Craig Levinson, the hardest thing you do well. I would say that's the hardest thing that you do with proper biomechanics, form, and technique that's safe, that's not going to injure you, but allows you to get out of your comfort zone. So it's a little bit of an art, finding that for each person and finding it in each of the basic movement patterns, things like squatting and hinging and lunging and pushing and pulling and carrying and sprinting and jumping. I would kind of throw in the categories of our most important functional movement patterns. Now, this is what I want you guys to understand. Movement is medicine. It is really the best medicine that we have. And study after study and research after research shows that. However, it needs to be prescribed by a professional. It's not about going into Catalyst Fitness and seeing what the guy or the woman next to you is doing and doing that, or watching the latest YouTube video, or banging your head off the wall until you vomit on the floor and pass out. That's really not what it's about. Like medicine, you need to make sure you're taking the right kind, doing it in the right dosage, and taking it in the right frequency. So I really want to focus on that and let that sink in. It is medicine. I mean, there are people that we will see that have acute low back pain that prevents them from working. And we will find a solution to take away that pain. And imagine if a person had epilepsy and they had seizures, and you had a pill, and you told them, hey, take this pill every 12 hours and you're not going to have a seizure. You're going to be okay. And then imagine they come back in to see the doctor, and the doctor says, hey, how are you doing? Have you had any more seizures? And they say, well, yeah, I had 3 seizures. And then the doctor says to them, well, have you been taking your medicine? Well, sometimes. Well, exercise to a large extent is like that. If you don't have time for exercise, you better have time to be sick and to not feel well. So want you to think about that. Another thing is, and this is just so important, study after study after study has shown that exercise is the number one thing that you could do to improve your brain health and cognitive function. Very rarely do I get a client that comes in and says their number one goal is to improve their brain health or cognitive function. But I really believe that it is the most important benefit of regular exercise. If you were to take an image of somebody's brain who's been sitting in a chair for 4 hours, it's kind of dark. Get them up and get them to do jumping jacks for 90 seconds and retake the same image, and their brain will light up like a Christmas tree. So it is, it's incredibly, incredibly important to do that. Now, I think I may have to switch over to, there we go. All right. Now I know we had about 40 minutes, so I'm going to kind of wind things down a little bit. All right. Now, when I talk about exercise as something that you need to be prescribed and you really need to do the right kinds and the right dosages and the right frequencies, I quickly want to give you a biomechanics 101 lesson that I learned from that article, Sitting on a Time Bomb. And in the article, they, in a very dramatic way, talk about the 4 horsemen of the apocalypse of the spine. And they just call 4 main things into place, okay? To set the stage for that, we know that the spine is strongest when we're neutral. So if we stand up nice and tall with good posture, we have between our butt, here's our butt, we have our lumbar spine or our S curve or the small of our back, and our thoracic spine is up here. We know our spine is strongest when it's neutral. Literally 2 degrees of flexion, which is the first horseman of the apocalypse of the spine, simply going from here to going to here in leaning forward and bending that spine forward, 2 degrees is enough to start a very destructive process for your lumbar spine if you're doing it under load with exercise. It takes as few as 6,000 bends of the lumbar spine to herniate a disc. It was estimated that the spine has a reserve of about 25,000 bends, and if you exceed that, you can injure your low back. There is no better way to herniate a disc or cause an injury in the gym through repeated flexion of the lumbar spine, specifically under load. I think Dr. McGill said that repeated flexion of your lumbar spine under load will herniate a disc as surely as a strongman entering a contest drunk. So not really great to bend over under load. Another thing is something called shearing. And that is, let's say if I had a bar in my back and I was squatting and my form wasn't good, and I was kind of going like this, there's a back to forward shearing force on your spine that can really produce injuries. Another thing is something called compression. So imagine if I had a bar and the bar was 500 pounds and I put it on my back, okay? It would be providing a downward compressive force. And, you know, when I was younger, 500 pounds, I could handle that okay. I don't know if I could do that now. And the last of the horsemen of the apocalypse of the spine is, I'm going to call improper twisting. So when we turn, we should be moving our hips and shoulders together as a unit, kind of like a baseball player, kind of rotating through their hips. Spine is neutral, and they move their hips and shoulders together. Slap shot, Josh Allen throwing the football, a tennis player hitting a tennis ball, pickleball. We could go on and on. So those are important things. Biomechanics matter. Posture is king. You just can't overcome posture. I remember sitting next to Dick Vermeil, the coach of the St. Louis Rams that won the Super Bowl, and his brother Al Vermeil, who was the first strength coach in American history to coach 2 world championship teams in the NFL and in the NBA. And I remember him saying, you know, low man wins. Posture is king. So now I want to talk just a little bit about making it easy to succeed. So one of the biggest restrictions on our life is time. And I want to let you know that it doesn't have to be all or nothing. So let's say you're working 80 hours a week, you're working double shifts, you're terribly busy. Well, many people, a lot of doctors are A-type personalities, and they know they need to exercise, but they don't want to do it unless they're really doing it right. You know, they're all in. It's kind of like all in or nothing. Well, I just wanted to throw this out there. If you exercised 5 minutes a day, that's 35 minutes a week, or 1,820 minutes a year, or 30 hours a year. And you could see 10 minutes a day goes to 60 hours a year of exercising. 15 minutes a day goes to 91 hours a year of exercising. And I'm not saying that that's ideal. I'm not saying that's what I recommend. I'm not saying this is going to give you a 6-pack. Okay. What I am saying is that there was a book written called The Slight Edge. And The Slight Edge, and I'll wind down here, is based on the premise that you succeed or you fail in life, or really in anything, any part of life, at first gradually and then suddenly. And I'll give you some practical examples of that. Let's say when you were young men and women, and let's say if you started at the age of 21 of putting 15 or 20% of your income away in a simple IRA or a 401k. There is no immediate gratification. It's not going to be like 2 weeks later, I'm rich. Okay. It's also not going to be that you're broken 2 weeks later, but do that for 40 years and you're going to be in a good spot. It's also, let's say if one of your goals is every day I get home from work, after I have dinner, I'm going to do some glucose clearing and take a walk around the block. And that walk is going to take me half an hour. Okay. There is no immediate gratification. You're not going to take that walk and come home with the six pack. And if you don't take that walk, it's unlikely that you're going to die of a heart attack in your sleep. But let me tell you, if you repeat those decisions and you compound this over time, the results are staggering, not only in your retirement plan, but in your health. And that goes for a lot of good habits. It could be one of those long days at the office where maybe you were unable to have lunch. Maybe you were at work at 6:30 a.m. and you couldn't have lunch, and you have a mandatory staff meeting at 6, and you're starving, understandably so. Well, let's say you go to that meeting and all there is to eat is pizza and chicken wings and ice cream. There is no immediate gratification if you eat the pizza, chicken, and ice cream. It's not like you're going to have high cholesterol and have a heart attack that day, but those decisions repeated over and over again and compounded by time make all the difference in the world between being tremendously successful in that area of your life or being a tremendous failure. And that's what I have for you today. So at this point, I'd be happy to, I know, Roger, I think you said we had about 40 minutes. I'd love to open it up for questions that anybody has.
Joe, thank you. Yes, so questions for Joe. Joe, this is fantastic. Dr. Gatewood, yes, sir.
Of course.
Probably one of the most fit people that I know.
Fantastic talk, Joe, really.
Yes, Joe.
So let me start by saying you and Mike will be very proud of me because I follow your advice. I start every morning doing some online diagnostic work, but about 9:30 I stop and I go for my 30-minute walk outside. And then then I go back, I eat, and then I go back to work. And about 1:30, I have my gym here with my Peloton, my Bowflex weights, my ball, my mat, and I do all the exercises that you guys have taught me over the years. So I do that for an hour from 1:30 to 2:30, and I eat lunch, and then I go back to work. And at 6, I stop work and I work out for another hour doing that stuff back there, which I absolutely love. So this is, again, you said make it simple. This made it simple for me because I didn't have to drive I used to go to the gym all the time. I was a gym rat. I'm Bob, I'm a gym rat. Yeah, this just makes it so great. And you talked about the effects of exercise on mental acuity. Believe me, after I exercise, when I go back to work, I'm all pumped up. I'm ready to go. And I feel much more refreshed than I did when I stopped to exercise. So that I find true as well. You also mentioned longevity. The word that I like to use, Joe, is health span. And I think that's what you're talking about. It's not just how long does someone live, but how healthy are they during that length of lifetime. And I think that's what you're trying to promote is health span. And I think that's absolutely critical. I mean, there's no sense in being, living till you're 85, but your last 20 years have been in a nursing home. You want to be, at home enjoying those 20 years from 65 to 85.
Absolutely.
So what you're doing is spot on. I've actually, and I'm gonna get together with you and Mike sometime in the near future, because I've been started writing it's kind of a white paper on a comprehensive sports, recreational activities, and exercise program that combines guys like you, cardiologists, pulmonologists, sleep medicine physicians, all the other, PT, go on and on. But the trying to promote locally sports, recreational activities, and exercise as a way of making our community healthier. And it's not just the exercise, as you mentioned, it's the nutrition, it's the proper sleep, it's stress management, it's all the other things that go into that. And being more on the, not just treating injuries, but preventing injuries, going further upstream. And I think that's, I think a lot of the people that you see, Joe and Mike, are people who have kind of, they've already had an injury, so now they got to recuperate and hopefully prevent further ones. But if we can move further upstream, that would be, I think that's our goal. When I joined Buffalo Cardiology in 1980, Bill Breen was the president, and he told us, he would tell us all the time, our job is to put ourselves out of business. And that is what I think we should all be doing as a profession, is, again, working upstream, improving that health span, reducing the amount of injuries, and promoting all the things that you and Mike have been promoting over the years. So I'll stop there because I know other people want to talk, but just fantastic.
Thank you, Robert. And you're just an outstanding example of doing it the right way. So thank God. Awesome stuff. Thank you. Thank you.
Joe, I think Dan Sheehan has a question there. He has a hand up.
Yeah, Joe, I'd love the simplicity that you brought forward, as well as, I think we know already 95% of what we need to do and how to educate our patients. And we also work in a culture that wants a quick fix, and quicker all the time. I'm curious to see what you might be seeing with Ozempic, some of the weight loss drugs. I would imagine for some patients, it possibly helps solve the real problem, but for others, it probably is not solving the real problem.
Dan, thank you so much for bringing that up. I have this presentation that I do on nutrition, and in that presentation, it talks about yo-yo dieting. And to me, Ozempic, Wegovy, there's a number of drugs like that to me, it's the new yo-yo dieting. And frankly, they scare the heck out of me. I'm scared to death of them. Particularly, there's been some research that shows that people are lessening their physical activities because they think they could just take a pill or get a shot. And the main problem is that they are highly effective for getting people to lose weight. The problem is that they can lead to a 40 to 60% loss of lean muscle mass. Now, if you want to talk about something that you could correlate to longevity, to function, to strength, I am certain that you could literally just take lean muscle mass, and that could probably be one of your single strongest indicators of longevity, health, function, quality of life, health span, as Dr. Gatewood was saying. And my concern with that is, are there people that have good, valid medical reasons to take it? Absolutely. Now, I'm going to speak on behalf of Beta, and Beta, if I misspeak, please correct me. I'm used to it. And you know, Beta's a registered dietitian. I remember when we started working together, I asked her, I'm like, you know, what's going on with Ozempic and Wegovy and all these drugs? And she had said her experience matched my experience, that literally almost every single person that we knew that were taking those medications were having serious side effects where they needed to be rushed to a hospital because they had a bowel obstruction or couldn't go to the bathroom or other issues. So I know that their research says that only like 1 or 3% have side effects. I don't know how that can be possible. In my experience, even though it is a small sample size, if my 20 and Beta's 40 and we're seeing, you know, 50 or 60%, I just think it's really unlikely that it's 1 to 3%. The problem is, going back to yo-yo dieting, you might think, let's say somebody weighs 400 pounds and they go to 250 and they gain it back. And then they, you know, they lose 50 pounds again and they gain it back, and they lose 50 pounds again and you gain it back. You might think, okay, well, they're right back to where they started. No, they are not right back where they started. They have lost 40 to 60% lean muscle mass at an older age in many cases. And they're not going to probably get that back. And so I have been told, I don't know anything about it. I'm sure some people on this call know more about it than me, that there are new drugs in the pipeline that do a better job in regards to not losing as much lean muscle mass and side effects. But it really scares me a lot. And that's the best way I could answer it. I know Dr. Tracy's extremely knowledgeable on it, as well as some other people in the call. Beta, what do you say? Would you agree with that in your experience? Bob, please go ahead.
Yeah, I was gonna say, yeah. So my advice to patients that have gone on those drugs is that first of all, like Dan was saying, this is not the single cure. This is to get you from where you are now to doing the things that you've just promoted over the last 45 minutes. We found that some patients get so heavy that it's very hard for them to get into an exercise program. It's also, they get depressed, they have loss of self, whatever it is, and so they eat. The drug does help to reduce their appetite, but as they lose weight, you know, my advice and continued advice is now you can start to get into an exercise program. Now you can start to think about eating more healthy and keeping that weight off. And I tell them too about the potential for muscle loss, and that's why it's so important to do the exercise, not just aerobic, but also resistance work. So to make it a well-rounded program. So I you know, it's you know, we don't have the long-term studies on those drugs yet. But you know, yeah, my feeling is you have to meet the patient where they are, and if this is what it takes, then I'll go with it. But again, they, you know, encouraging them to couple that with what you and Mike are preaching.
Got it. Beta, would you add anything to your experiences, or Mike, do you have anything to add to that?
I will say that I agree with Dr. Gatewood that there are situations that it is difficult to motivate the client to do what they need to do in this. There are situations that it's helpful. It's that our culture, though, is so focused on the fast fix that there are so many times that they just revolve in there. I met a woman, she has lost a lot of weight. Her answer as she comes off the drug and starts gaining it is I need to go back on it. And so it's difficult to get them to understand that this is just a piece of it. It becomes their new answer. And then just as Joe presented, if we're not walking, if we're not sleeping, if we're not moving, every system is slowly degenerating. And so even though we're a certain size, we're not any healthier. And I think that's the huge risk that we're going to see over time. And I would say with Joe, I'm equally as afraid. But we'll see what the next round of drugs will bring as well.
Bob,
Yeah,
go ahead.
Yeah, to that point, yeah, I think that's so important. And that's why I don't like the idea of, physicians just dispensing these things without anything else. Our experience when we had our wellness program, and these were patients that were at high risk for cardiovascular disease, and most of them were overweight or mostly obese. And then they had diabetes, hypertension, all the other things. So it is a sort of a culture change for them. It's been shown scientifically that to change a habit and to get into a habit, it takes at least 3 months.
Mm-hmm.
Working with patients, it was a minimum of 3 months to get them to change. But I do think that when they see some gains now, and it's important when you start the drug is to start introducing the exercise and nutrition part, because as they see the weight come off, they get pretty excited. And if you can, again, get those habits ingrained in them, I think that's the key. And as you both been saying, the answer is not just the pill. I hate that. It's the wrong approach, I think. They may get some benefit. We don't know. We don't have the long-term studies, but if you can get them from being so unable to exercise and unable to change their eating habits, if you can get them to change, we know that will help. That will make them better, and that will help their health span.
Bob, I'm not a doctor, but I've already gotten 50 emails telling me that they could get me those drugs for my clients if I want. So it's kind of crazy. Any other questions at all?
Joe?
Yes,
Yeah,
Michael.
Joe, I think we're in the honeymoon period for those medications. And what I mean by that is, you're going to see a lot of advertising on TV until we realize the long-term side effects. We lose, as you know, 0.5% to 1% of our strength from age 30 to 70, and it doubles to 2% after that. And when you look at the average is 44% lean muscle mass, as you mentioned, that's unacceptable for our patients. Right now, Bob mentioned health span. The average man in the United States may live till 77, but it's 11 years. They're 66 and beyond that till they're 77. Those 11 years are not met. Their health span is not matching their lifespan. And all the things you mentioned, strength is still number one. And it releases myokines. And those myokines basically get into your brain, your kidney, your heart, and really, really help us to stay healthy. And it's fascinating that even though nutrition is very important, that, and I hate to use the word trump, but exercise does a little bit trump the nutrition. And what you mentioned is excellent, Joe, that the strength training, walking. And I tell people, my patients, I tell them, you need to get outside and walk. Get off the treadmill unless it's bad weather. Get outside, take your headphones off, listen to the birds, listen to the traffic because they're beeping at you when they're trying to, come up behind you. And as Bob does beautifully, gets outside and walks. And I think that's so important for us to remind our patients that that is a better atmosphere. And it is a little bit different than the treadmill. And you do a great job with your patients, Joe, with strength training. And there's probably nothing more important than strength training in releasing those myokines that get all of our organ systems healthier and keep them healthy. But I think these drugs are in the honeymoon period, and we're going to find out the side effects are not worth it. and losing muscle mass is unacceptable. Great
Yeah.
job, Joe.
Thank you. Thank you.
I have a quick question.
Sure.
I'm sure you have seen Brian Dayball recently.
Yes.
Sure.
Supposedly he lost 50 pounds on Pilates. Is that
I
that
I would say that that is really unlikely. Maybe he was doing Pilates and changed his nutrition, hopefully, or my guess is there are other factors. I suppose anything's possible, but I'm not the most educated person on Pilates other than from a biomechanics, universal laws of human movement perspective. They violate a lot of those postures and biomechanical principles, and it causes a lot of injuries.
Oh,
Yeah,
that's
I think
interesting.
Joe's hitting a good point, if I may say that in McGill's lab, we studied many of these postures. And even though Pilates is popular, if you look at what Joe's saying, 2/3 of those exercises involve flexion and rotation, which are detrimental to the spine. There was a therapist I met at Joe's office once, and he said, I have all my physical therapists certified in Pilates. And the first thing I wanted to say to him, but I didn't want to be rude, is why would you do that? There's so many other forms of certifications that are better. And it
Oh,
just,
wow.
it's the marketing is good. If you guys look at Curves as an example, is the fastest growing business in the United States of any kind. And now they're closing all of them. Why? Because hydraulics make no sense. There is no eccentric contraction on a hydraulic machine that Curves uses. So you have just flexion of the biceps and extension of the triceps, but there's no eccentric, which half of life is eccentric, right? And they're closing because that form of exercise did not stand the test of time. Pilates is fine for some people if they do it correctly, but a lot of it's done on mats, and we're not getting people up and moving around. And chair yoga is another thing I don't quite understand for my patients who can get up and move while they're sitting in a chair. We sit in a chair way too much. So anytime we can get up and move, I think is best. But Pilates, when studied in McGill's lab, which I'm pretty much the only one I remember that did any of that work up at his lab, it's 2/3 of those exercises were detrimental to the spine, and that's not acceptable. So I'm not against Pilates or yoga or anything like that. There's huge benefits, but we have to understand the mechanics, like Joe just mentioned, are not correct for a lot of those postures.
You know, in that article, just to illustrate what Mike said, the Sitting on a Time Bomb article, imagine years ago, we'd sit at desk, we'd have our regular phone. How many people would kind of flex forward and then twist to get the phone in properly? And that's exactly what Mike's talking about. The flexion, added rotation, doubles to triples the destructive force on your lumbar spine. So it's a little scary. In fact, it's funny. One time, Michael and I had a mutual client, and he said, Joe, I don't know why, but every time I come here and I work with you, and Michael, the client was Jerry, he said, I feel great. Whenever I do Pilates, I feel terrible. And I said, well, why don't you bring your Pilates instructor in here and we'll talk? And so he did. And, you know, and she goes, well, you know, I'm very familiar with biomechanics in the lumbar spine. And I'm like, well, gosh, if that's the case, I don't know why he's feeling this way. And I said, well, can you demonstrate some of the exercises? And everything that they did was flexion of a lumbar spine. And I didn't want to embarrass her or put her on the spot, but I'm sorry, Bob, go ahead.
We'll have Robert go ahead, and then we'll call it for the day. So go ahead,
Okay.
Robert. Yeah.
So speaking of flexion of the spine, a lot of people talk about how valuable the deadlift is. Can you just comment on that, Joe?
Yes, yes. You know, thank you so much, because now you're in my wheelhouse. Actually, I was a New York State deadlifting champion and record holder. So if you take a look over here, you see that little kettlebell. In life, yes. In life, let me see if I could change the camera a little bit. We have to pick things up off the ground. No question. But whether it's squatting or deadlifting, each person has their own unique ancestry and therefore hip architecture. It's different all the time. So once again, biomechanics is kind of really simple. Mike and I worked with a great therapist, his name's Chris, who taught us really simple. Biomechanics is about maintaining your masses and spaces. I have a mass, I have a space. I have another mass. I have another space. I have another mass. So if I go like this, I've lost my masses and spaces. I have flexed my lumbar spine. So what I do is I believe each individual has their own unique squat biomechanical pattern and deadlift pattern. So if you could see me here, I am pulling the floor apart, pulling the knees apart, reaching forward, okay? Now, my lumbar spine is neutral. I'm reaching forward, pulling back, spreading the floor, and I am maintaining my masses and spaces. If I have to go like this, I have lost my masses and spaces. I am in flexion. I'm beginning that destructive process. So whether it's a squat, kind of coming down here, whether it's a single leg hip hinge, whether it's throwing that football, whether it's hitting that baseball, whether it's hitting the tennis ball, whether it's the slap shot in hockey, whether it's running, it's about maintaining your masses and spaces. So deadlifting can be an effective exercise. See how I have it on a step? I would say probably 95% of my clients need to be on a step. They need to be lift because look at, if I'm here, if I'm pulling the floor apart, reaching forward, hinging back, and I'm doing a true hinge, see where my hands are? Bar is there, or the kettlebell is there, or the weight there is great. But if I have to lower and flex to get to the bar, I'm taking an exercise that could be productive and healthy and beneficial and turning into something that could be destructive.
Excellent. So, Joe, thank you very much. Just a couple of things I did want to mention, a couple of things in the chat. Charity said, thank you so much for this session. Be that nice to see you from Charity Bergio. From Dan Sheehan, thank you so much, Joe, for a wonderful presentation and discussion. Off to pickleball. All right. I also want to mention that we had Elaine Prajet, Dr. Elaine Prajet here from the Netherlands, and Dr. Noor Bag in from Pakistan on the call this morning. So, Joe, your influence is indeed international and worldwide. I'm looking at the calendar here, and 1 month from today, my friends, I'm going to be in Omaha doing a TEDx talk out there, delivering it to, I think, for TEDx Omaha. And then the next one is December. So we will take the next couple of months off, and we'll begin in January, fresh, new again. And before we go, Dr. Gatewood, congratulations on 50 years, being a magnificent physician and a dear friend. And so thank you all. Beta, I will see you later today. I have to go take a walk. All right. Joe.
Thank you, guys. I have a client as well.
Thank you all very
Have a
much.
great day.
It
was a pleasure.
Thank
Thank you.
Take care, everyone. Take care, friends.
Bye,
Robert,
everyone.
safe travels. Michael, we'll see you soon. Take care. Begin it. I'll see you in a couple hours.
Yes. See you soon.